Good evening, professor and classmates. This is my week 2 SOAP note. And so I'm bringing to you patient YA, who's a 56-year-old Hispanic female that presents to the clinic alone and appears to be a good historian. And her chief complaint is she's had pain on and off in her wrist for about 6 months, but recently, up until the past 2 weeks, the pain has worsened. And she states that she doesn't have much grip or strength in bilateral wrists. So after interviewing the history of present illness, the onset of this was 6 months ago, but up until 2 weeks ago, it has been constant. Prior to that, it was intermittent pain. Patient reports that the pain is constant and it feels sharp and almost like a pulling sensation in the wrist. It's aggravated by movement or picking up, carrying heavy objects. It's relieved by inactivity. She denies taking any medication right now to treat this. She denies any trauma to her wrists. Currently, her pain at the visit is a 6. Says that with overexertion and sudden movements, it does go up to a 10. And at times it can go down to a 4, but it's still a dull pain. So she has no pertinent medical history that could contribute to anything like this. The patient doesn't have history of osteoarthritis or anything of that nature. One important fact that I did find, I did ask her what she did for a living, and she's a stalker at Walmart in the electronic department. So she says she's constantly putting TVs and heavy items on the shelf and taking them down, up and down. She does that constant motion. She does work 10 to 12-hour shifts. Upon exam, she was noted to have full range of motion with flexion and extension. She did have limited range of motion to abduction and adduction, and did note some pain and discomfort when that was assessed. She does note to have tenderness and pain to the radial side of bilateral wrists. I did do a Tinel sign and it was negative. I also did the Phelan sign, that was negative. We went ahead and did a Finkelstein test, and that did come out positive. She was noted to have weak bilateral grip. So based on the assessment finding, I did refer to Bogues for the diagnosis. I have the diagnosis as Decravein's tendinopathy. A differential diagnosis is osteoarthritis of the trapeziometacarpal joint. And that was ruled out because assessing, I did assess the fingers as well, and she had no crepitus or pain at the joint at the base of the thumb, and that's where you find that joint. So that was ruled out. I also, differential is intersection syndrome, and that is usually affected at the forearm. Patient typically reports, pain or tenderness right up here. And actually, upon palpation of the aspect of the wrist, she denied any pain or tenderness here. It was mostly on the radial aspect. So that was actually ruled out with the positive Finkelstein test and no pain at the dorsal forearm. My plan was referenced from Agarwal and Ring, and what we did is went ahead and provided the patient with some splints. So we gave her some forearm-based thumb spica splints, which with interphalangeal joints, free joints. So it pretty much just stabilized her thumb and her wrist. I did give, we prescribed the patient ibuprofen 800 milligrams twice a day. And this is for the pain and to also reduce any inflammation that is taking place in that tendon. We also advise the patient to apply ice, a lot of resting and reducing that excessive overuse, and applying ice to the affected area to help reduce the inflammation. Patient was advised to follow up in 2 weeks, and this was to evaluate whether the treatment was effective. We did let the patient know that if the pain does worsen, our next, right now we're doing the non-invasive, the very conservative treatment. If she shows to not have any improvement, she's a good candidate for a glucocorticoid injection in that tendon to help relieve the pain and the inflammation. So patient was advised to make a sooner appointment if the pain did worsen, but we went ahead and set her up for 2 weeks for a further evaluation. Thank you.